Welcome to the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board certified dermatologist, and I'm here to discuss with you all issues relating to the skin that you're in. In this podcast, we tackle the topic of the day fast and get you the take-home points you need so you understand the issue and are ready to either fix it or ask the right questions at your next dermatology appointment. Let's get started. Today we're going to talk about Ellacor. Ellacor is a new, first-in-class breakthrough technology called MCT, which stands for micro-coring technology. It is a machine that removes tiny pieces of skin to cause an immediate skin tightening. The pieces are so small that they do not leave any scars. For example, think about the fact that we inject people with needles all the time and that little tiny trauma to the skin doesn't cause a scar. People don't get scars from that little needle prick. This is the same width of a piece of skin that is being removed. It is FDA approved for the lower face, but it can be used on the neck, jawline, arms, stomach, really anywhere to tighten up loose skin. The procedure is done with local anesthesia. First, we numb people with topical numbing cream, and then we use lidocaine with epinephrine injections to make the area fully numb. The procedure takes about 10 to 15 minutes. I get to set the machine for the depth of the skin removal and the density of the pieces that we are removing. And the deeper and the more dense the setting, the more aggressive the procedure. Obviously, the machine has limits on it for safety. Sometimes people need more than one procedure depending on how much skin laxity they have, how much loose skin they have, what the situation is, and the area. It is truly a miracle procedure to be able to tighten skin without scarring. The healing for this procedure is incredibly quick. Immediately afterwards, patients do look pretty beat up. It is a little bit of a bloody procedure, but the bleeding stops pretty quickly. And then the thing that's incredible about it is how fast the healing takes place. I tell patients to clear at least a week from their schedules, but after about 3 days, you can get makeup over it, and it heals just really fast. It's a very rapid healing process. Some people will wear a mask to cover it while it's healing. That's fine if you're out and about, but if you're home or working from home, it's best to just leave it open. The aftercare is pretty simple, just either Aquaphor or Vaseline, something like that a few times a day, a mild cleanser, cool water, avoiding the sun, typical things that you would expect. One caveat for this procedure is that you cannot do it if you're on blood thinners. There are many other procedures that I do, including Botox and fillers and biopsies, that even if someone is on blood thinners, they can be done safely. But at this point in time, I would not recommend Ellacor if you cannot stop your blood thinners. Another caveat for this procedure is that one is sometimes not enough. It depends on how severe the skin laxity or loose skin is and what area of the body it is, but sometimes we need to do it more than once. If we are going to do it more than once, we like to separate it by at least 4 to 6 weeks. So in summary, Ellacor is a revolutionary new treatment called micro-coring, where we remove teeny tiny pieces of skin from the face or other areas. It is FDA approved for the lower face. And when we remove those teeny tiny pieces of skin, the skin immediately contracts and gets tighter. So it works for loose skin and skin laxity. Very good for fine lines and wrinkles. Very good for tightening up the face and other areas of the body. We do not do it if you're on blood thinners. You need to clear your schedule for about a week. People look a little bit beat up right afterwards, but the healing process is incredibly fast. It's really an amazing new technology for tightening skin without scarring. I'm really glad to have it in my practice, to be able to use it and offer it to my patients. It's fantastic. Thank you so much for joining me today on the Dr. Rebecca Baxt podcast. I'm Dr. Rebecca Baxt, board certified dermatologist. I hope this episode was informative about the skin that you're in and that you enjoyed listening. If you found this podcast useful, please give us a 5-star rating wherever you get your podcasts. It helps others find us so we can help them too. Just a caveat to remember, this is not medical advice, and please see your dermatologist or doctor for questions pertaining to your specific situation. I look forward to talking to you again in the next episode.